Hi friends, today we are going to discuss about hypertension management. First of all, I would like to give you brief information about hypertension. What is hypertension? Hypertension means elevated blood pressure. All of a sudden spikes in BP and the condition is known as hypertension. So in today's class, we are going to discuss how we can manage hypertension effectively, when to take hypertensive medicine, either morning time or night time, what would be the best time of taking hypertensive medicine. In this class you are going to learn what would be the best timing for taking antihypertensive drug, either morning or night, what should be the medicine timing, and what are the dangerous mistakes that we have to avoid and reduce the risk of heart heart attack and stroke. And there are some practical tips that can also control hypertension effectively. Now, why timing actually matters to control hypertension effectively? Actually, BP is not constant throughout the day, and the general pattern of BP is like that. In early morning, it suddenly spikes. During daytime, it always stays elevated during waking hours, and at night time, it generally dip. So when you are going for sleep, BP generally dip into the most of the patient, but in some patient, it can be different. So the timing of taking BP medicine depend upon the pattern of BP of every individual. So what would be the best time to take medicine, either morning or night? The most important thing in this context, I would like to say that the taking medicine at the same time every day would be very effective to control hypertension, because according to the various research, there is no single best time for everyone, because everyone have different blood pressure pattern, and as per that pattern we have to take or doctor advised medicine at particular time. But in general, I want to explain something. First one, common medicine that are used to control hypertension, but always taken in the morning, like diuretics or water pills. These are the medicine like furosemide, chlorthalidone, and hydrochlorothiazide are the diuretics that comes under antihypertensive drugs. But technically, how they control blood pressure? Actually, these diuretics or water pills generally increase the urine output. So, what would be the best time to take this medicine? The best time to take this medicine or diuretics in the morning. Why? Because if anyone take this medicine at night, it can cause disruption of sleeps, because as I have already told you that diuretics are the water pills. It control blood pressure by increased urination. So whenever any individual take this medicine during night, it can cause multiple nighttime bathroom trip, and that may lead to the disruption of sleep. So these are the medicine like furosemide, chlorthalidone, and hydrochlorothiazide, always taken in the morning. Now there are several other medicine that can be taken at night. First of all, amlodipine. Amlodipine is a prototype drugs, or we can say first line drug for the treatment of hypertension. Technically, these are the calcium channel blocker, and its time are flexible. It can be taken either day or night. Generally depend upon the blood pressure pattern of an individual or patients. Now the another type of drugs like telmisartan, losartan, and olmesartan. These are the drugs that technically angiotensin receptor blocker, and it can be taken at night for better 24-hour coverage, and it also can be taken at morning. Same thing, it's depend upon the BP pattern of patient. There is no universal rule. The right timing depend upon the BP or blood pressure pattern of the patient. So now, what are the common mistakes that we have to avoid? First of all, most of the people generally stop medications when they feel that their BPs are normal. But this is very big mistake and it can lead to the stroke as well as heart attack. Because your BP is normal, it means your medicine is working. And if you stop that medicine, you invite to the heart attack as well as stroke. That's it. Now, the second one is changing timing without consulting your doctor. Most of the people in India generally self-adjust timing for taking medicine, and that may lead to the unwanted side effect. So remember, don't change timing because your healthcare provider recommend medicine as per your BP pattern. So don't change timing without consult of your healthcare provider or doctor. Now, some people doubling the dose after a missed tablet means when they missed dose and when they remember that dose has been missed, they doubling the dose, and that may lead to the serious adverse effects. So never doubling the dose after a missed tablet. Now the next thing and the last thing to avoid, taking medicine only when you feel symptoms. Actually, high, hypertension or high blood pressure is a silent killer. Most people feel completely normal because they are taking medicine. They suddenly withdraw to take medicine. But when they feel symptoms, they suddenly start the medicine. That is very bad practice. You have to take antihypertensive drug regularly to avoid heart attack as well as stroke. Now, there are some tips to control BP. First one, I always taken medicine at the same time every day. Second one, always use a pill organizer to reduce the probability of missed dose significantly. You can also set a mobile reminder to ensure that you never forget the dose of antihypertensive drug. Always monitor blood pressure regularly and tell to your doctor so that he can track your BP regularly. And apart from this, always maintain healthy lifestyle along with antihypertensive drug to effectively control your hypertension. Reduce salt, exercise regularly, sleep well and avoid mistake. And the next one, when to call your doctor. If you feel some symptoms like dizziness, fainting, suddenly headache or low BP, all of a sudden fall or frequent fall, swelling of legs. So never stop BP medicine on your own. Please consult your healthcare provider or doctor immediately after you experience these symptoms. Now the bottom line is that there is no single best time for the BP medicine. The best time is the time that recommend your doctor, fits your routine and help you stay consistent. So always follow your doctor's advice, always stay consistent to take medicine and never stop medicine alone. Always consult with your doctor if you feel anything, any problem or feel any adverse effect. So all these are about the hypertension management. If you feel this video productive, please share with your friends and family. And for more such type of videos, please follow my channel Code and Cure. Bye bye. Good night.